I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
Is there anyone in the line over there who has not spoken at all yet in the microphone? The gentleman in the blue shirt is very interested.
Dr. Alex Kwan, Chairman of Anesthesia in Southeast Community Hospital. I'd just like to make some remarks here about comments made by Dr. Pitts. First of all, I'm not here to judge on the safety of ECT, but I am here to say something about the safety of anesthesia and the management of the patient. I'm one of those persons that Dr. Pitts suggested the most dangerous person to have in the treatment room. Unfortunately, from my point of view, the most dangerous person is the one that uses drugs they're not trained to use. And the remarks that the procedure is very safe. Yes, Dr. Pitts mentioned something about having the monitors and not looking at them. Well, we do look at the monitors, and we found some things that would make our hair stand on end. For example, question of the arrhythmias. And these patients that have pre-existing cardiac disease, if you check the monitors, they do happen, and you have to have very high concern on how to treat them. Also, the question titled question of blood pressure dropping in this patient or being high. If you do not monitor them, then you would think the whole procedure is safe. Now, if you take the time to check the blood pressure as the treatment is being done, which we do, it's not extremely unusual to find blood pressure shooting up to the 200 to 250 range and dropping off to the 50 range. Although they may be transient in certain individual in the proper situation, you can lose the patient very quickly that way. And if you're going to lose a patient, you're probably going to lose them first with airway problems and next with heart or cardiac irregularity. So I think that from the standpoint of this, that it should be something not taken too lightly. Thank you.
Thank you.
One shock treatment can equal 150 joules of energy. This is equal to dropping a hammer on someone's head from higher than a 5-story building.
At the FDA hearings, the testimony on the reclassification of electroconvulsive devices cited the literature as whether signed or pulsed, typically about 150 joules of energy in a treatment. With the new Thymatron electroconvulsive device, if you check out at 400 volts maximum of 0.9 amps and 320-some millisecond pulses.
Could you finish up your question, your remarks?
Yeah, I would like somebody to tell me. I'm a teacher as well as a physicist, and I brought a kilogram with me. Teachers like to demonstrate. Now, this is a kilogram. It's 2.2 pounds. Heavier than a hammer I used to hit a nail. But I wonder if possibly like Dr. Stein could tell me how high I would have to drop this kilogram from in order to have it hit the ground with 150 joules of energy.
I don't know if that question is in the purview of the panel, but thank you for your report.
Well, just a minute.
I'd like to go on to the next person.
This is only 10 joules of energy. You're talking about dropping it from higher than a 5-story building. That's physics. Supposedly in pre-med backgrounds.
Thank you.
I never got it.
All right, out with your gum.
Huh?
Out with your gum.
Okay, this won't hurt. It'll be over in just a moment. Uh-huh. What's that?
Conductant.
Oh, dab will do you. Right, Mr. Jackson.
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well,
Now just bite down on it.
oh.
That's right. Just bite down.
Huh?
Now bite down on it.
Good. Are you ready?
Ready.